Conservative MP for Bury North. James Daly joins us. James, thanks for giving us your time.
No problem at all. Good afternoon.
Good afternoon. Now, you've been critical in the past. Are you still unhappy about the Greater Manchester region going into Tier 3 restrictions?
I am. I am yet to be convinced by the scientific evidence that Tier 3 restrictions will make any difference whatsoever to the infection rates that we have. The one thing that we have seen, and the previous speaker just talked about as being in enhanced restrictions since the end of July, is that restrictions and lockdowns do not work, and therefore I'm far from convinced that Tier 3 is the appropriate tier for our area.
So would you be agreeing with the Leader of the Opposition, Sir Keir Starmer, to go into a circuit break, national lockdown for 2 to 3 weeks?
Absolutely not. I wouldn't agree with that at all. That just simply defers the problem. We cannot continue on this circle of having lockdowns, whether they are national or local, to address this problem. A national lockdown would have a devastating impact on jobs, on businesses in my constituency. And it is quite easy for Sir Keir Starmer and others to talk about a national lockdown because it has no financial impact upon them whatsoever. So, no, I don't believe a national lockdown is the right step either.
So you don't want to see any sort of restrictions then in Bury North? You're quite comfortable seeing the cases rise? No,
I want to see, and I want scientific evidence that is going to show that we have a long-term plan to tackle COVID. The WHO are very clear that they are asking governments not to use lockdowns as the principal means of tackling the coronavirus that we have at this moment in time. And why is that? Because they make poorer people poorer. So my view is that we have to go back to first principles. We have to go and look at how we address this problem. We have to offer protection to those who are most at risk from this virus, which are people over the age of 70 with comorbidities, with underlying health problems.
Sure.
We have to look at how we protect people in care homes.
Right.
And then we have to address
James,
that problem. Because, sorry, can I just make a further point, which is very important? When you're looking at the coronavirus cases, if we're going to have a discussion which is simply on the basis of the number of cases, that's numbers on a piece of paper. We need to know in each particular area what are the public health outcomes of this increase in cases. We, over the last 3 or 4 weeks in Bury, have had a very worrying increase in the number of cases. But as of the 8th of October, at both North Manchester and Fairfield hospitals, which serve an area in North Great Manchester of well over 1 million people, there were only 8 people in ICU beds. And we had, I think, 71 people in hospital. We had no evidence whatsoever from Jonathan Van Tower when I spoke to him this week that he understood the age, the demography of these people, because if the people who are being affected by this, which appears to be at this moment in time to be younger people, then we know that younger people, from all the evidence that we have, are less likely to have long-term public health consequences as a result of this disease. So I think we have to understand local data and not just look at this as numbers on a piece of paper, that an increasing number clearly presents a risk.
Sure.
That's not the only story.
The problem is, though, that you began your answer by saying the WHO do not advocate for lockdowns as a primary means of controlling. Now, the word primary is doing a lot of heavy lifting there because they also say that they believe lockdown is justified to buy time, reorganise, regroup, rebalance resources and protect exhausted health staff. Now, isn't it the case that right now, had we used the first national lockdown that we did to up the testing, to really have testing where it should be, and more importantly, like every expert in a country that has successfully tackled the coronavirus, like South Korea, Singapore, says your tracing system has to be up and running and really functioning properly. Last week was the worst week for the test and trace system. Isn't that where the fault lies? And actually, one of the suggestions that many people are going towards is if you use this 2 to 3 week circuit breaker, you can use that time to get your test and trace up and running so you can do all the things that you've just said. You can find out the exact demographic of the people who are being affected. Who is moving to where? Is it students? Who needs to be traced and told to self-isolate?
We clearly need to be in a position where we have much more testing. Testing hasn't been at the level where it needs to be. In terms of track and trace, the local team in Bury is in a 92% success rate in terms of track and trace. So I believe that more monies need to be transferred down to local areas because local teams are doing an excellent job. So no, we can do that. We can do all of those things without, in my view, without a national, like what we call it, a circuit breaker. We have thousands upon thousands of people working extremely hard within the NHS services. We've had the same advisors advising us for a number of months. I do not believe it is beyond them to put in place the level of testing and the level of track and trace that we need without a circuit breaker, which will be devastating for jobs and will be devastating for businesses in my area, I believe, and in others throughout the country.
Okay. Thank you for giving us your time. That's James Daly, Conservative MP for Bury North. The time is now 19 minutes past 1.